Hi, I'm Joseph Durrani, and I'm a cardiac surgeon at the Mayo Clinic in Rochester, Minnesota, and I'm here with a special patient of mine, Dannika. So tell me, Dannika, we met about 3 months ago. How did you feel before heart surgery?
Well, I felt pretty good. At gymnastics, it was like I got a little tired, but I didn't really notice it that much. It was mostly my coaches who noticed.
Yeah, that's commonly the case. So you're a gymnast. I remember that quite well, a very elite gymnast. And so were you able to keep up with the things in gymnastics that you normally could do, or?
Not really. Like for beam, I was like really good and I was getting like 9s. And the next year, I was getting like 8s and lower because like I was out of energy.
So the decreased energy. So did you know what kind of a heart defect you had?
No.
Did the doctors try to explain it to you a little bit before you made a trip to Rochester?
Yeah.
So what do you remember anything about what they told you?
A little bit. They just said like I think they said that there was like a hole in my heart or something like that.
You had a hole in the heart, and then there was a valve that was leaking poorly, all of which would have contributed to you not feeling as well as you used to. So when they told you that at some point you were going to need surgery, was there anything that you did to try to get ready for it or prepare for it, or?
Not really. I just like did a bunch of gymnastics before, and I had mono too before surgery. So it was sort of
That really slowed you down, probably.
Yeah.
So how about your family and friends? Were they supportive and helpful? And
Yeah, it was mostly like my 2 cousins and Cassie and Lexi and my mom. And I would talk to them like for like about everything.
And so when they told you you needed surgery, were you hoping that the results of surgery were going to help you get back to gymnastics and get back up to those 9 scores?
Yeah.
Yeah. And so since surgery, I know that your stamina's gradually been getting better. It's only been a few months, but do you feel like you're on your way to being able to compete actively again? Yeah. So when you came to Mayo Clinic and you met the different staff members, did you feel that people explained things to you pretty well? Did you
Yeah.
kind of know what you were getting into?
Yeah.
Were you nervous?
Yeah.
A little? What was the thing that you were worried about the most?
Probably not being able to go back to sports.
So you weren't really worried about what was going to happen in the hospital. You were worried about what you were going to be able to do down the road. Tell me about your hospital experience.
It was like really awesome because like all the people there were really nice and like humble and everything.
Did your mom or dad go to the operating room with you when you went to sleep, or did you go on your own?
Yeah, I think my mom did for a little bit.
And that was reassuring for you?
Yeah.
And then what about in the ICU? I know the nurses, they make a real fuss over the children. Did they do a good job? And they explained everything and walked you through it?
Yeah.
Did you feel like your experience in the ICU was better than you thought it was going to be, or worse than you thought it was going to be?
Better.
Better? I know there's a lot of worry about the tubes and the breathing tube in the mouth. Was that experience okay for you?
Yeah, I think that before I should have like learned like some like signals to tell my mom like what I was doing or like what I needed, because like I couldn't really talk with the tube.
Yeah. And it came out pretty soon, and then the other tubes eventually came out, and you were up walking around the hallways, and eventually everything came out, and then you were getting ready to go back home. So when you left the hospital and you were going home, were you worried about anything when you were going home?
The only thing I was worried about was like getting in a crash because there was like a bunch of crashes up ahead.
On the highway?
Because it was really like snowy.
But you, of course, got home safe and sound.
Yeah.
There was still snow on the ground, right? Yeah, I know. That's the challenge with weather in Minnesota, you know. So if you had any advice that you wanted to give other children your age that were going to have heart surgery, what would be the 1 or 2 things that you would want to tell them?
Probably learn hand signals and like just do everything the doctors say so you can recover as fast as possible.
So you felt you did all the things that the doctors asked you. And so now do you have any, I know that you are a gymnast, but from a school standpoint, do you have any ideas what you want to be when you grow up?
I sort of want to be like either a Olympian, gymnast, or a lawyer.
What about a doctor?
A doctor, maybe. I don't like watching blood.
I know. Sometimes patients make the best doctors, though, because they're really sensitive and they're knowledgeable about things because they experience it themselves. You'd make a great doctor. I would tell you that you should consider that. Does that sound good?
Yeah.
So tell me, just to close out a little bit here, tell me what the future gymnastics scene looks like for you. You're going to be in what grade?
I'm going to be in 7th grade.
7th grade? So your hope is to do gymnastics through grade school and then do it again at high school? What's your strongest event?
Beam.
Beam? That's the scariest event for me to watch, I will tell you. I'm always nervous, you know, with that hard wooden beam of slipping and falling, but that's great if that's your best one. Is there anything else that you wanna say to either me or the other people that took care of you at Mayo while you were here?
Thank you.
Thank you for being such a great patient. And if anyone has any questions or has other inquiries about Epstein anomaly or any other congenital heart disease, please feel free to contact us. Dannika, thank you very much.
Thank you.
Yeah.